friends. I'm Dr. Tamim, and I have a topper with me from Father Muller's College. And please introduce yourself and tell about your rank.
Hello, everyone. I'm Trupti. I studied in Father Muller's and my All India rank is 77.
Great. So, Trupti, from which college are you? You said Father Muller's.
Yes.
Which year you passed out?
In 2019, I finished my internship.
Okay. So, how does it feel to get such a good rank?
It feels very unreal, sir. I was very excited. Initially, I didn't believe it when I saw my rank, but yeah, I think all the hard work has paid off.
Great, great. Anybody you'd like to thank before we start discussing how you prepared?
Yes, I would like to thank my family, my parents, my uncle, my aunt, my cousins, and all my friends who were always there for me, and my seniors from college who guided me whenever it was needed.
Great.
And my staff, faculty at DBMCI also.
Great, great. So, Trupti, basically, what I think everybody wants to know is, how did you do it? Such a tough exam, 1.6 lakh people give the exam. So, how were you able to achieve this, magical result?
Sir,
How was your journey, basically?
Initially it felt very undoable. It felt like I wouldn't be able to do it. But with the constant motivation that was given in classes and at home, when they kept telling me that no, you can, anything is possible. I think it was a lot of hard work and perseverance and consistent hard work throughout the entire year that has made it possible for me to achieve this.
Okay. Right. So, how was your preparation? Like, did you start preparing in UG period, or when did you really start preparing for PG entrance?
Sir, I started only after I joined DBMCI. That is, end of March is when I started preparing for.
Okay,
entrance.
so you started after listening to the orientation class.
Yes.
Okay, right. So, how would you, advise the juniors? Like, what is it really? What did you do in the 6-7 months that was there? How was your NEET performance last year?
Last year, when I wrote during internship, I got 34,000.
34,000,
Yes.
great. So from 34,000, you have come within 100.
Yes.
77th rank, great.
Yeah.
So what exactly was your journey like? Once you joined us, how did you start preparing? What subject did you start with?
I went according to the classes itself. Whatever classes were taught, I made sure that I finished studying it at least once, and then doing whatever MCQs I could within that gap before the next subject started. And I took every class test seriously and tried to do well in every class test that I attended.
Okay, so how was your performance in the class test? Like, you were in the first page?
Yes, sir.
You were in the first page
Yes,
most of
sir.
the time, right? So what do you think people who are preparing for PG entrance should really focus on? So one is, yes, they need to attend the classes regularly.
Yes.
They need to make their own notes.
Yes.
What else do you think is required?
I think revision is the key, because even when you read it once or twice, you don't remember most of it, and you have to keep going back to it over and over again. And so many things you won't even remember just before the exam as well, but that doesn't matter. You should only concentrate on what you do remember and try to keep all the positives in mind.
Great. So, obviously, revision is the key. But then, did you start revision once all the subjects got over, or were you simultaneously revising along with each subject as it was over?
No, so I started only once classes got over. Revisions was only after that.
Okay, okay. Any particular subject that worried you the most?
Pharmacology.
Pharmacology.
Yeah.
So, how did you handle that? Like, what efforts did you do to make sure that you don't lose marks in that subject?
I made a list of the things that I would keep forgetting in pharmacology, and every time after I finished one subject, regardless of what subject it was, I would go back to those points and look at it again and make sure I remembered those things.
Right. So generally we suggest key for 19 subjects, 19 subject class notes are important.
Yes,
and
sir.
then there's a 20th book which contains all the very volatile stuff. So did you make any additional book to keep all the volatile points, or was it covered in the each book itself?
No, I had a separate book where I wrote down all the things that I kept
that you really
Yes, sir.
forget.
Yes,
Great.
sir.
Okay. How did you plan your revision, and how did you find the vibe session?
Vibe session was very helpful, especially for revision, because apart from the pictures, there were notes as well that we had written on the side, very precise, and we could recollect other things apart from what was there in the white book as well. So that was very helpful.
Okay.
My revision, the DBMCI group had put up videos on how to plan your revision as well. So I tried to stick to that as much as possible, where they had told us you finish your first revision by 1 month to 1.5 months, and then the next revision will take a month, and then another 15 days for the last revision.
Great.
I tried to stick to that as much as possible.
Okay. So when you were revising, you just went from first year subjects to final year, or like you followed any pattern?
The first revision I went subject wise, first year, second year, third year. Then the second and third revisions, I focused on what I found difficult. So I would start with pharmacology, and then like my difficult subjects I would do first,
okay.
and then I would do the ones that I found easier towards the end.
Okay. So how do you find the NEET pattern of questions this year?
It was very clinical. Even the for part A, which was just anatomy, physiology, and biochemistry, it was very clinically oriented questions, and you really have to use your mind. It's not everything is not
you can't just
factual.
memorize.
Yeah.
So I think the factual questions are coming down.
Yes, sir.
People who are memorizing are getting filtered out.
Yes, sir.
People who are having a good clinical orientation, who are able to relate the subjects,
Yes.
they are going to have an advantage. Right. So I think the trend that is there both in AIMS and the NEET exam that we are seeing is key factual questions are down and more of concept based questions. And that's what they are trying to say, key vertical integration and horizontal integration. And I think that will be implemented even more in the exit exam where clinical aspects will be more relevant rather than, very basic subject sciences. So how are you finding the final year subjects in NEET and how did you handle them in the exam?
The questions were very lengthy, and a lot of history was given, and it took if we had planned 40 seconds for one question, it would invariably take 1 minute.
Right.
So
Okay.
but the part A was not as lengthy, so we had saved up some time for part C. Other than the lengthy factor, I think if you know your concepts, you'll be able to answer the questions easily. So
Right. So any important words of advice you'd like to give to your juniors?
Stay motivated, keep working hard. Towards the end, it might feel like it's impossible, but if I can do it, I think anybody else can.
Right. So any faculties that you felt were really very helpful in your preparation?
Yes, you especially, because apart from teaching us medicine, you always kept us motivated, and it was throughout our session, and you kept telling us that it was possible, and there were times where it actually brought tears to our eyes when you spoke and you told us, like it was very heartfelt, and I think it motivated a lot of us. And anatomy was very helpful. OBG was very helpful, and every other staff, I think they've done their best, and we really like it helped us so much.
Right. So I think our best wishes with Trupti. I hope she continues to do well in her future career as well. And any final words?
Thank you, sir.
Right. So good luck to her, and I hope she continues to do well in her career again.